Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, November 16th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon and thank you, Brad. As you all know, we are continuing to see COVID-19 cases rise in number dramatically in our city and across the region. Dr. de Villa will update on that in just a moment. We took action last week which goes beyond what has been done in any other place in Ontario in order to help stop the spread of the virus, and we haven't ruled out further action. In fact, we spent considerable time on the weekend discussing what else should be done. To me, the status quo is not enough, and even our stronger series of measures should be made stronger still. The advice right now from our public health professionals to Toronto residents is very simple and continues to be very simple. Please stay home, except for essential travel like getting your groceries, going to the doctor, getting your exercise, or going to work if you can't work from home. Do not visit with family or friends that you do not live with, indoors or outdoors. Wear a mask, wash your hands, keep your distance. If you're sick or have symptoms, please isolate until you get better. But above all, please just stay home. The city is working with the province and regional public health units to actively explore what further public health measures may be needed to protect residents and businesses. Like many other jurisdictions across Canada and Europe, we are being confronted by this second wave. I know people are tired and they're frustrated by this pandemic, but I also know that together the vast majority of people are committed to doing everything possible to stop the virus and to break the second wave. Our goal throughout this emergency remains saving lives, protecting residents in our long-term care homes, keeping schools open and safe, and ensuring our healthcare system continues to have capacity to deal with all of our healthcare needs, COVID and all of the other healthcare needs at the same time. We do know that the public health measures necessary to stop the spread of COVID-19 are hurting hardworking businesses and the employees and owners of those businesses. They are completely innocent victims. That is why we've been advocating continuously to the governments, the other governments, to provide emergency support beyond what we've tried to do to be of help to restaurants and to other establishments. They have responded, the other governments, in several different ways, the federal government in particular most recently passing emergency legislation passed by the House of Commons on November 6th, 10 days ago. Today, I sent a letter to the leadership in the Senate of Canada urging the quick passage of that very piece of legislation, which is called C9, an act to amend the Income Tax Act, Canada Emergency Rent Subsidy, and Canada Emergency Wage Subsidy. And as I mentioned, that bill was not just passed, but it was passed unanimously by the House of Commons, the elected House of Commons, 10 days ago. The word emergency is found twice in the title of the bill for good reason. That bill is now before the Senate for consideration, and we cannot afford any further delay. The bill will help businesses here in Toronto and across the country weather the COVID storm, including programs to help with wage subsidies and assist with the payment of rent. An increased amount of assistance for payment of rent for those who are ordered closed by way of public health measures. I understand the role of the Senate, and I think that its deliberations can often be useful in the cause of good public policy. But if ever there was a time for sitting late at night, sitting all night, sitting on weekends to get this emergency bill passed, this is one of those times. I'm urging senators to pass this bill as is and as soon as possible without any further delay. It was done previously, just in March of this year, with a previous emergency bill designed to help people in this country to weather the storm of this pandemic, so it can be done again. It could be done in one day. This is a business emergency as well as a health emergency, and in my view, it is desperate for these small businesses to get the help that's going to be coming from the federal government when this bill is passed. Every hour counts, and I believe the work of the Senate and the work they must do could be substantially speeded up. We've seen legislation pass through the Senate in a day when circumstances required that. This is one of those times. And now it's time for Dr. de Villa to present her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 538 new COVID-19 cases. 176 people in Toronto are in hospital with COVID-19, and 42 people are in the ICU. In the last 7 days, we have reported 3,359 cases of COVID-19 in our city. The month is now half over, and so far, we've seen 5,721 reported cases of COVID-19. The case counts in Toronto are alarming. It's fair to ask if the restrictions put in place last month made a difference in the spread of the disease. I believe they did, and I have some examples to share with you today. As I told you earlier this month, we know that case rates per 100,000 population dropped in certain neighborhoods where they were very high prior to the imposition of the restrictions. In particular, we saw this trend in parts of downtown Toronto, where there is a high density of bars and restaurants. For example, the Niagara neighborhood had a case rate prior to October 10th of 164 cases per 100,000 population. By November 7th, the 2-week case rate for this neighborhood had dropped to 35 per 100,000, a reduction in the rate of 129 cases per 100,000 population. More broadly, it's concerning that while we see evidence of infection prevention and control efforts by local businesses, we still see examples of COVID-19 spread, particularly when staff are interacting with each other, such as in the lunchroom, or if they carpool together to work. We also continue to see transmission at weddings and funerals, despite reduced gathering sizes. It's natural for people to want to be relaxed and close in situations of trust, familiarity, or high emotion. But these are the circumstances that drive risk and infection. This is why it's so important that you think about how to limit contact with others, even when the situation is a place you want to be and with people you want to be with. The virus doesn't make that distinction. It will infect whenever the circumstances are right. The strategy behind the restrictions is to limit the ability of people to spend time together in high-risk environments where the chance of infection is heightened. This is a difficult choice, but a necessary one. We have a study underway with York University which indicates that the measures we put into place did produce the kind of results we'd hoped for. Using Toronto case data up to October 25th, researchers at the Laboratory for Industrial and Applied Mathematics at York University developed a transmission dynamics model for COVID-19. Using this model, researchers identified how different public health measures have impacted the average number of contacts between people. The average number of daily contacts per person was reduced from 7 during the period following Stage 3 reopening to approximately 4.8 after reverting to a modified Stage 2 on October the 10th. It's often difficult to prove what didn't happen as a result of taking action. But I would argue if the case counts at present are high, and they are, we can reasonably assume without public health measures, the numbers would have been much worse. There is well-documented evidence from many other jurisdictions about what happens when public health measures are not in place. Some may argue that by limiting locations where people can socialize, we are simply driving risky behavior elsewhere. There is some logic to this, which is where the role of individual choice becomes so important, and which we can all agree no restriction or rule can force. Between our own value systems and evidence like the York University study, which shows an obvious decline in person-to-person contact, I hope people will see their own power to turn the COVID-19 case count in the right direction. It can be done. Significant benefits can come from everybody putting their minds to it. We have to believe that things can get better, which I do, and I hope you do too. The strength of our COVID-19 response and our ability to limit the spread sits on a foundation of what we believe and what we do as a result. It's why I acknowledge so frequently that it may seem hard to believe that simple things like keeping a safe distance or wearing a mask can make a big difference. Not just here, but all around the world. Scientists and medical experts confirm it's true. Belief is important as well in terms of the risks we take, in terms of who we see and where we see them, and in terms of who we choose not to see as well. So I encourage you to believe in the power of the steps for self-protection. I encourage you to believe that keeping apart for now will make an important difference in the long term. And I encourage you to believe that this will end. How it ends is in large part in our own hands. It was never possible to come through a pandemic of this scale without suffering and loss. But when it is over, how we have come through it will be largely a result of what we choose to believe and how we act based on our beliefs. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. On November 13th, our Medical Officer of Health issued an order under Section 22 of the Health Protection and Promotion Act. This order strengthens COVID-19 protections in Toronto in order to prevent the further spread of the virus and prevent our healthcare systems from becoming overwhelmed. Notice of this order is available publicly at toronto.ca/COVID-19. The penalties associated with being found guilty of an offence under the Health Protection and Promotion Act range from up to $5,000 per day for an individual and up to $25,000 per day for a corporation. Under normal circumstances, orders issued under the Health Protection and Promotion Act are enforced by Toronto Public Health Inspectors. However, as part of our coordinated COVID-19 enforcement efforts, both Toronto bylaw enforcement officers and Toronto police officers have now been delegated the authority to enforce these additional orders. This change has been implemented to ensure that our enforcement efforts remain coordinated and to ensure that we are able to effectively enforce these additional orders. Over the course of the weekend, our enforcement teams were active across the city. This included proactively inspecting for compliance with the requirements of the recently amended regulations and orders that came into effect on Saturday, as well as responding to complaints. One of our proactive inspection initiatives this weekend focused on the entertainment district in downtown Toronto. Our enforcement teams inspected approximately 80 restaurants and bars in this area. 71 were found to be in compliance with the regulations and orders. 5 charges were laid for non-compliant indoor dining, and 4 warning letters were issued. Also this weekend, 31 tickets and 13 cautions were issued for illegal activity on Toronto beaches. We extinguished 30 illegal bonfires on Toronto beaches this weekend, including 3 that had been left unattended. We responded to 25 complaints relating to gatherings on private property this weekend. This included responding to a large birthday party being held in a commercial storage unit in the Kipling and Bloor area of Etobicoke. Upon arrival, Toronto police officers observed in excess of 100 people in attendance. In addition to this party being shut down as a result of violations of the COVID-19 regulations and orders, charges under the Reopening Ontario Act were also laid against the organizer of this party. Further, the storage unit that had been rented to host this party was not designed nor equipped for this purpose. As such, follow-up inspections are ongoing with respect to compliance with Ontario Building Code and Ontario Fire Code requirements. It is important to note that in our experience, the vast majority of the businesses in Toronto have been and continue to be in compliance with the regulations. For example, between June 27 and November 10, our enforcement team inspected 4,104 restaurants, bars, and other eating and drinking establishments for compliance with the Reopening Ontario Act. Of those, 376, or approximately 9%, were found to be non-compliant with the COVID-19 regulations. Perhaps more importantly, 91% of these restaurants, bars, and other eating and drinking establishments were determined to be in compliance with the requirements of the COVID-19 regulations, orders, and bylaws. I want to thank every resident and business owner of the city who continues to do the right thing as we all work together to stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Just a reminder to reporters on the line that you will need to unmute yourself to ask a question. We also have staff on the line, including those from shelters, bylaw enforcement, parks, and the Toronto Police Service. First question is to Mark McAllister from City News. Go ahead, Mark.
Thank you very much. First question, I guess, is you've got the support, Dr. de Villa, both from the board this morning and from what we've heard from Mayor Tory as well this afternoon, to implement more measures when you see fit. I know you've put some emphasis on getting people to do things on their own and that they have their own power, but of course, many people are also looking to you and your leadership to take it to another level. What can we expect in the next round of measures, and when might they come?
So Mark, I think you ask an important question, and one that I can assure you we have been discussing and speaking about at great length. You heard the Mayor mention in his remarks today that there have been active discussions, and these are very, very complicated decisions that need to be taken with great care, with great thought, and ideally with great collaboration and coordination across the range of partners in order for those measures to be as successful as possible. So of course, we're continuing to do that important work, and we'll be sure to tell you and the rest of the public as soon as we are able to do so. But please know we are actively, constantly monitoring that which is happening and very, very carefully considering and deliberating on how best to move things forward in order to protect the residents of the City of Toronto and the rest of the region around us as well.
I would assume based on that, you're not going to tell us what's been discussed at this point, so we'll leave it at that. Despite efforts last week to simplify your messaging, tell people to stay at home, stay away from others outside of their household, over the course of the weekend, there still seemed to be quite a bit of confusion over what people can and can't do or should not do because they can go outside, but they're not supposed to be. How do you address the confusion that still seems to exist despite the fact that you tried to simplify your messaging last week?
Well, you know, I think that when there are changes, and we have seen some changes as of late, there is always that period of time for transitions. This is, I think, fairly typical of any transition, whether we're talking about COVID-19 or any other circumstance. But I think the answer to the question is exactly as you've stated it. How, making sure that we are as clear as possible in our messaging and as simple as possible in our messaging. I think the final point I would make in this regard refers back to the question, your earlier question of me. The careful consideration and deliberation and coordination with other jurisdictions and with other levels of government in order that, we can make sure that we're all on a very, on the same page and can communicate a unified message that is easy for the public to understand and is patently clear, even though it may represent a change relative to what was happening before.
Can I just make a comment on that, Mark, and to say this? If everybody just followed what I call the basic overarching advice, which is to please stay home, except for, really quite essential visits they had to make out. Some people have to go to work, others have to go shopping, say, once a week. If everybody did that, then a lot of these other measures wouldn't even be necessary to think about. But I guess the other side of it is you have to then, since some people have some issue with that or difficulty with that, is to offer fewer places for them to go. And that, I think, will cause people, together with the repetition of the advice of please staying home or the request to please stay home, to find a more successful place that we need to be. But, the overarching advice, if everybody just followed it and stayed home, and when they ventured out of home, they did it only with people they lived with, and they wore a mask and kept their distance, then that would go a long way to addressing this thing. But in the meantime, I guess it's necessary to look at things that will offer fewer places where people can get together and be in close contact with one another.
Okay, thank you. We'll go next to Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. Dr. de Villa, I need to follow up on Mark's question, the first one there. I know you're being a little cryptic on this because nothing's been decided yet, but when you say to the Board of Health this morning that more measures are needed, what areas are you looking at that targeted measures could help? What is an area, if you could just give us a couple examples of things that are so far not working that need to be addressed that measures could help address?
Well, Matt, I think the mayor has hit on a few of those points just in his earlier remarks. Effectively, what we need to do, we know how COVID-19 spreads. It spreads from person to person. And it is a combination of things. There's that which government can do and that which can be done at the individual level. So as the mayor rightfully points out, knowing that it is the gathering and the close contact of individuals, particularly in close spaces, that gives rise to the spread of COVID-19, then to the extent that government is able to take action to reduce the likelihood that people are actually able to convene in those settings, then that's one step that we can take, and there are many different variations on that theme. At the end of the day, though, it does come down to, people also participating in what reduces congregations and close contact in closed spaces. So it's the combination of these two things, public health measures, and yes, the individual choices to actually adopt self-protection measures, right? Watching your distance, wearing your mask, washing your hands, staying at home as much as possible, limiting your contact to the greatest extent possible to those with whom you live. This is the kind of thing that will actually see us through and get us to the other side of this pandemic.
Okay, thank you. Mayor Tory, this morning in an interview, you were talking about the possibility of further restrictions for capacity for retail settings. I just know since then there has been a lot of interest in the retail sector contacting your office. Can you clarify what exactly it is that you're looking for? What settings are continuing to be an issue there? Specifically, is this malls or small shops? And when would these be even considered to come into effect?
Well, I put it forward.
Or when would we even have an announcement on that?
I put that forward when you were pressing, as you are now, for details on things that we've talked about. We've talked about a whole bunch of things, and on the expert advice of our medical officer of health, who's done such an excellent job presenting us with the kinds of things that are going to help to reduce contact between people. And so I put it forward as a hypothetical example, and I might be in trouble with somebody for doing that in the context of what we're trying to do, to have a kind of a rational discussion between governments, between regions, with business and others, just about kind of what's practical here. But it was an example given that just goes like this. If you have a store, if you have a mall, and you have, basically unlimited numbers of people who can go in those premises, and I should say many stores and others have adopted their own protocols with respect to lineups outside and this kind of thing. But, there was more of that taking place in the spring than is taking place now. And so it leads to more things that could be described as a crowd scene. And crowd scenes are not good for restraining the spread of this virus. And so it's an example of something you could do to limit the capacity, as we've done in other instances, of the number of people that could be in a store at a given point in time and that sort of thing. But it's entirely at this point hypothetical, because those discussions are ongoing, and they're the different kinds of measures that basically cut down on crowd scenes and scenes where people are in close contact with one another, especially in an indoor setting.
Okay, thank you. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi there. Following on Matthew's question, I guess to Dr. de Villa, given that I think there's a sort of anecdotal talk that when people are out shopping, they're often like moving around quickly, and we've seen lots of stores limiting number of people. Is that actual a source? It seems like, compared to weddings, where, as I understand it, there is no hard cap, it's just a capacity limit, that there is an obvious demonstrated problem with infections. I haven't heard of a lot from retail. Is that actually a problem?
So, David, I think you're quite right that there are certain circumstances that we know give rise to increased risk of COVID-19 spread. You heard me mention today in my remarks one of the circumstances that you talked about, gatherings for celebratory events like weddings and funerals. We know that that has been a problem, not only here, but in fact throughout the world. It's those kinds of situations that we need to look at, amongst many others. What are the kinds of circumstances in which people are prone to want to gather together, particularly in closed spaces and for prolonged periods of time? These are the circumstances that give rise to that risk for spread of COVID-19, and those are the kinds of circumstances that we need to consider as we make our decisions. Of course, it's also the kind of thing that people themselves at an individual or household level can reflect on and consider, and to think about how best to limit the likelihood that they become the next source of infection by making the good choices and adopting the measures of self-protection that we've talked about so many times here at this table and at lots of other tables as well.
Thank you. And my follow-up is an enforcement question for Chief Pegg, and I'll double barrel it if I can. Number one, just that about 10% of restaurants, it sounds like, that were checked in the entertainment district had some problem. Is that alarming to you? And can you tell if that was major problems? And number two, did we see any religious gatherings related to Diwali? Any action taken on that as happened in Brampton?
Thanks, David. So first question, I would, like we said, about 9% or so is what we have seen or what we have experienced with respect to non-compliance. I think first and foremost, our goal is 0%. We're looking to get to the point where we don't have anyone or any business that's operating contrary to the requirements of the public health regulations and COVID-19 related orders. But having said that, I think I would say heartened by the fact that translates, like I said, about 91% or so of our businesses are operating in compliance. This weekend, the majority, and as I indicated in my notes, what we saw with respect to restaurants were about 50% of, or I should say, the violations that resulted in enforcement action on the part of, by way of ticket, were for indoor dining operations that were non-compliant. So hard for me to judge that on a scale as to whether I consider it serious. I would say I do consider it serious, and that is really drawn out of the expertise and advice that's provided by Dr. de Villa with respect to the opportunity for spread. The second question relating to Diwali and the religious, other religious type and celebrations this weekend, I'm not aware of any significant issues that were experienced here. Obviously, I'm not on that front line, but in the updates I've received over the course of the weekend and in our strategic command team meeting this morning, that was not a predominant issue dealt with by our enforcement teams this weekend. So I'm very pleased about that.
And I think, David, in order to be fair to our friends that were celebrating Diwali, even Mayor Brown, and you may want to check with him on this, said that they had some very large number of places of worship in the that were celebrating Diwali on the weekend, and all but one, I think he said, had been compliant. So I don't, because we don't want to, suggest that there was widespread, non-compliance even there. I heard him saying that, and he said it on our mayor's call today. So you may want to check with him on that. In addition to us not having any reported incidents of that happening in Toronto. Some of the major mandirs, I know from talking to the leaders of the faith and asking them to help us with this, actually were closed, and people just didn't go at all. They celebrated at home.
Thank you, Mayor. We'll go next to Brian Passafume from the Toronto Sun. Go ahead, Brian. Unmute yourself, Brian. There you go.
There, did that work? Okay.
Yes, you're on. Go ahead.
Can you hear me okay?
Yes, sir.
Yeah, sorry about that. Threw me there. Good afternoon, everybody. Hope you had a great weekend. Question for Dr. de Villa. For the past few press conferences, you've remarked that previous public health measures like the 28-day stage 2 rollback had a measurable positive impact. But overall case numbers suggest the opposite, each day seemingly setting a new record. Can Dr. de Villa explain exactly what metrics are being used to determine this success and why they aren't being used as a primary measurement of how the city's doing instead of just strictly case numbers, hospitalizations, and deaths?
So Brian, as I tried to make clear in my remarks, there are a number of measures that actually demonstrate, or indicators that demonstrate that public health measures have made a difference. Whether you're looking at case rates per 100,000 for neighborhoods, particularly where there's a preponderance of bars and restaurants, and what the case rates were like in those neighborhoods before the measures were put into place and what happened after the measures came into force, you can see significant drops in those case rates. As well, when we look at the kinds of studies that we're doing in partnership with other universities and research partners, like the one I referred to in the remarks, a modeling study done in partnership with our colleagues at York University, we can actually see a drop in respect of the number of contacts per person from the period of time immediately following when we moved to the so-called stage 3 reopening to when we reverted back to at that time the modified stage 2 in around October the 10th. So these are just a few examples. I gave a few other examples last week as well. So this is just to give a flavor of the fact that yes, there is a difference when public health measures are put into place. And fundamentally, we know that the way to reduce COVID-19 spread is to actually reduce contact, face-to-face, close contact with other people. The more we are able to drop those contacts, the better off we will be in respect of COVID-19 spread and all the consequences that come thereafter, whether it has to do with illness that then leads to hospitalization, whether it has to do with circumstances and outbreaks in long-term care homes, whether it means that our children are getting sick within our school systems. We're trying to keep our schools up and running. We know that the more community spread there is, the more challenging it is for our hospitals, for our long-term care homes, for our schools. And so the kind of data that I've been talking about for the last few days is to give people the sense that actually when you take these measures and when each and every one of us actually partakes in those measures of self-protection and really goes out of our way to limit our interactions with people with whom we don't live, we can make a difference. We do see the drop in COVID-19 spread, and we will be a healthier community for that.
Okay, my second question, a little bit of a different line here. I'm not too sure exactly who the best person is to answer this, but we've had some readers report receiving tickets for failing to display residential parking permits, despite the city reporting that COVID-19 delays and manufacturers have delayed the passes from being mailed out. These are people who are on automatic renewal programs, and many didn't even get their April passes because of the COVID-19 delays. And they were originally told, and I believe if you go to the website, it says that enforcement is on hold. Is this something the city is aware of, and what advice would you have for people who end up with tickets that clearly aren't warranted?
I will just undertake to look into it. As you know, there have been changes that we made during the course of the pandemic, especially in the early stages when there were a lot more people that were leaving their cars at home during the day because they weren't going to work, and therefore it created problems, obviously, with the way the system normally operates. And my understanding was that we'd gone back to more of the normal kind of circumstance, but if there are problems, of course, with permits being issued because of our own operations at the City Hall, then people shouldn't be penalized for that. So I will check into that and perhaps have an answer we can give directly to you, probably by the end of the day, if not first thing tomorrow.
Well, in fact, we have Barbara Gray on the line from Transportation Services. Barbara, can you add to this at all?
Sure. Thanks, Mayor. That's exactly right. We did suspend operations for some time at the beginning of the pandemic, and we are back to normal. We've started reissuing passes. I believe we started back up again in July, and there is enforcement that has started to happen again. If people feel like they've not received their passes or they've not been treated fairly, then if they contact 311, we'll certainly look into that and get back to them promptly.
Thank you, Barbara. We'll go next to Holly Mackenzie-Sutter from the Canadian Press. Go ahead, Holly. Just have to unmute yourself, Holly. Holly, you there? Just click on mute on your computer, please. Okay, we'll come back to you, Holly. Next up is Jason Chapman from 640 News. Jason, you there?
Yeah, hi guys. Can you hear me okay?
Yes, we can. Go ahead, please.
Hello.
Okay, great. Oh, there's Holly, guys. If you
We'll,
want to go to Holly
we'll
first,
come
that's
back
fine
to you,
by me.
Holly. Go ahead, Jason.
Okay.
Great. Guys, I just want to talk to you about, of course, my dog started barking right now. I want to talk to you about closed confinement areas in the city that I'm not sure have been addressed recently. There are so many pictures floating around of TTC buses and streetcars and subways that are full. The restaurants have been closed because of close contact, and I just see these pictures more and more, and I just want to ask about these full streetcars. Are people at risk as much as they would be in a restaurant if they board a TTC bus or streetcar or subway that's full and distancing isn't possible? And what should be done about it?
So, Jason, first let's address the question of risk. First and foremost, we know that for a number of people, particularly those who are essential workers, that public transit is their primary way by which they get back, get to work and home from work. So this is clearly an important service, and of course we need our essential services to continue. The other issue, though, in respect of risk is that, it is generally a shorter period of time during which you're on public transit. And for the time that you are on public transit, you can wear a mask, whereas within the context of a bar or restaurant, just given the nature of the activity, eating and drinking, you can't really wear a mask. And you are in much closer contact, speaking to people, without a mask, so there's much more opportunity for COVID-19 to spread in those circumstances. So, and I think finally the other point I would make is that where possible, employers and employees themselves are encouraged as much as possible to try to shift travel times. And again, I realize that this isn't always possible in every circumstance, but where it is, shifting times to where there is not where the buses or the streetcars or the subways are not as busy would be another way to reduce risk. But certainly risk within public transit is definitely reduced compared to what you would see in a restaurant or bar where you have a lot of close contact without a mask, and within the context of certain bars and restaurants, alcohol consumption on top of that. So that's just a little bit of a sense as to the risk differential.
Brad, is anybody on from the TTC today?
No, there isn't, but
Okay, well, it's fine then, because I'll just comment on this, Jason. The fact is that we have some challenges that are on particular bus routes that have been well documented, and we've applied substantial additional bus resources to those routes, but they are an ongoing challenge. But I would say that with respect to the overall levels of ridership, with respect to, say, the subway and streetcars, they're still running in the kind of 30% range in terms of the ridership as per normal, as against normal. And so, we're watching this whole issue every day and talking about it repeatedly with one another and trying to allocate, resources where they can be allocated. But the overall ridership is still, well below 40%. And the problems that have been identified have been more on some bus routes, which has been acknowledged, and we're trying to apply extra resources to that as opposed to a broader problem with streetcars and subways. I'm sure with occasional exceptions, but I think the rule is generally that if there's a challenge, it's on certain bus routes at certain times.
And just a quick follow-up, guys. It's in the same vein as Dave Ryder and Matthew Pegg questions, but I'm not. If you write our stories and suggest that you're considering restrictions on how many people are allowed into a Costco or a Loblaws or these stores where we see people very close together. You've seen the pictures at Costco where people have been elbow to elbow, they've been packed. Would we be wrong to say limits on the amount of stores are being considered? And then if you can address what will happen in the coldest months where people have to queue outside of those establishments, I'd just be curious on thoughts around that as well.
So without getting into great detail, certainly, we are discussing, as you've heard us say earlier this afternoon, those circumstances and situations and how best to effect measures that reduce the likelihood that people congregate within closed spaces in close contact with each other, and especially doing activities where it's difficult to wear a mask or to maintain physical distancing. These are the kinds of considerations that we're actively discussing, things that we're looking at. I'm not really prepared at this stage to get into further detail than that, but really it is just a question of looking at those circumstances where congregates or crowds tend to form, where people get into close contact with each other and in closed spaces. We know that those are the circumstances that give rise to COVID-19 spread. The other piece, as you've heard me say before, is of course asking our public to really think about limiting their contact as much as possible, staying at home as much as possible, reducing close contacts with everyone outside of the people that they live with in order to reduce COVID-19 spread. And we know that when we take these actions together, that which government can do to reduce the likelihood that people are finding themselves in circumstances where they're in closed spaces, in close contact, and in crowds, and for people to actually take the actions to avoid those kinds of settings. That's, I think, how we get to the greatest success until such time as we are able to rely more on vaccines and treatments to help us get through this pandemic.
Okay, thank you. And certainly Jason Stewart-Green from the TTC could help you on any specific details you have regarding transit. Okay, we'll go back to Holly Mackenzie-Sutter from the Canadian Press. Holly, go ahead, please.
Hello, a question here for Dr. de Villa. Just on the kind of repeated message about personal responsibility and personal actions that can change the trend. As you just said today, people are getting sick at work on their lunches and commutes, and or people in long-term care when they actually don't have any choice about exposing themselves. So I'm wondering how or if these further measures are going to look at how to make workplaces or these common spaces safer for employees, rather than limiting consumers going in and out when we don't really even know if customers and I guess the front-facing side of the businesses is what's actually driving the spread.
So I think, Holly, there are a number of different things. We've talked, and you've heard me speak at length this afternoon and on previous days around restrictions and measures that can be put into place to limit the likelihood that people congregate in close contact with each other. But there are also, supportive measures or measures that can be done to enhance protections that are in place. So amongst the instructions, for example, that I have put out there to businesses and workplaces include such things as, making sure that they really carefully review their heating and ventilation systems and whatever filtration systems they have to make sure that those are in good working order, because good working order HVAC systems, as they're known, actually can be helpful. There are some studies that demonstrate that. We've also asked for businesses and workplaces to think about such things as how, might they be able to introduce things like compliance officers, actually assigning somebody and designating somebody within the workplace to ensure that rules and the kinds of measures that have been taken within workplaces are actually being followed appropriately. These are the kinds of things and supports that can be done within the context of businesses and workplaces. On a broader level, we are always in the realm of public health talking about the social determinants of health and recognizing that those access to social determinants of health and addressing health inequities is another core fundamental. So it is a combination of restrictions, if you will, so as to limit the opportunities for people to gather in closed spaces in close contact with each other, and as well supports that I think will give us the best chance at success as we seek to reduce COVID-19 in our community.
Brad, may I just mention one more? And it was discussed by the regional mayors today and chairs when we got together for our weekly meeting. There are people going to work today in this city and outside of Toronto who are maybe having symptoms but are afraid to go and get tested because they're afraid if they test positive they will lose their paycheck and their family will have no means of support because they've either concluded that the existing government programs don't apply to them and or they can't count on support from their employers necessarily. And so we indicated today, the mayors and chairs did, that we believe there needs to be an urgent discussion between and among the different governments and the private sector with respect to being able to have these people confident that they can go and get tested and should go and get tested without fear of losing their paycheck and not being able to provide for their families. And I think that's a discussion we should have sooner than later, much sooner.
Follow-up question, Holly?
Thanks. Yeah, follow up. I have quite a few, but I guess I'm wondering if you can say when people can expect to hear about these new measures, and if the mayor could maybe elaborate on what, are you asking for kind of universal paid sick leave, or would that be something that city supports?
If you're asking about the other mayors, it's very interesting because if you read the statement, it says, it's a collective statement we all issue each week. We understand that further public health action may be needed in response to the rising numbers and based on public health advice. The provincial framework allows for this to be done as local circumstances dictate. And we had a very good discussion today, but the circumstances are different in all parts of this broader region. Halton and Durham and Peel and Toronto and York are all different from each other, but there was a consensus that people should put forward what they think is best for their own region. And so that is part of a process that has been responsible for discussions back and forth between different health units and between the health units and the province over the course of the weekend. And that whole process continues. So I guess it will be more dependent on the outcome of all of that, recognizing, and Dr. de Villa may wish to comment on this, that the best, most effective orders just based on legislative jurisdiction and so on come from the province, but that obviously cities like Toronto and other regions and municipalities have their own ability to do some of these things if called upon to do so.
Did you want to add something, Doctor?
No, I think the mayor is quite right. There is some advantage, clearly, and we've seen that over the course of the pandemic. There is certainly advantage to having the province take on actions at a provincial level or to take on actions at a regional level as well. There's no question. From a communications perspective, that's also easier, but clearly the framework does allow for us at the local level to take on actions as needed, as we see fit based on our local epidemiology and our local circumstances, and that's exactly what we did. So you've seen that I have issued strong recommendations, instructions, and indeed gone to using my authorities under the Health Protection and Promotion Act, given the circumstances as we see them here in Toronto and what we felt was necessary in order to best control the risk. So if that's what's warranted, we'll do that, but certainly there's advantage from a provincial level for action to be taken there as well.
Okay, thank you very much. That concludes today's briefing. We'll be back here again on Wednesday, November the 18th. Be safe.